Hello, my name is Fan Yang. I'm one of the radiation oncology residents at the University of Alberta in Canada. My presentation today is going to be on the evaluation of an interdisciplinary simulation-based learning module in improving learners' comfort level in managing neoplastic spinal cord compression. I have no disclosures. Neoplastic spinal cord compression occurs when the tumor compresses on the spinal cord. Without prompt treatment, patients may lose neurological function in their limbs. Sometimes, patients may lose their ability to walk permanently, and that can be especially devastating. As you can imagine, the longer the tumor compresses on the spinal cord, the higher the risk of permanent neurological compromise. As such, spinal cord compression is treated as a radiation oncology emergency and needs to be treated within 24 hours of diagnosis. From the onset of diagnosis, a coordinated effort from the entire radiation therapy team is needed to ensure that the patient gets treated in a timely manner. This team involves radiation oncologists, medical physicists, radiation therapists, dosimetrists, and other support staff. In these scenarios, both clinical competency and interdisciplinary teamwork skills are extremely important, and both of which can be improved through practice. Essentially, we wanted to use simulation-based module to allow learners in each discipline to practice dealing with the situation in a low-risk educational setting so that they can be more competent and efficient when faced with a spinal cord compression in a clinical setting. Simulation-based medical education has been used extensively in other specialties such as ICU and surgery. To the best of our knowledge, there are no published studies evaluating the effectiveness of simulation-based medical education in the context of emergency on-call scenarios in radiation oncology. Thus, we're proposing a curricular intervention that involves an interdisciplinary simulation-based medical education module that involves radiation oncology residents, radiation therapy students, and medical physics residents at the University of Alberta. The learning objectives for each of the learners will be determined by faculty members in the specific departments. Prior to the course, we will have a pre-course questionnaire and interview to assess the baseline level of comfort and confidence that the learners have in dealing with these clinical scenarios. The course will contain a didactic lecture followed by a hands-on simulation of a scenario using a simulated patient and a dummy linear accelerator that we have in-house. This is followed by a post-course questionnaire and interview designed to assess the level of competence and confidence that the learners have compared to prior to this course. The whole course will be video recorded for the purposes of future course planning and descriptive analysis. We have several overarching objectives for our simulation course. Number 1 is to improve the learner's competence and comfort levels in their respective roles as it relates to the emergency radiation therapy for spinal cord compression. Number 2 is to improve multidisciplinary teamwork in radiation therapy. And number 3 is to facilitate research in interdisciplinary simulation-based medical education in radiation oncology. That's the end of my presentation. Thank you very much for listening.